A vertebral compression fracture is where one of the vertebral bodies, which are the square building blocks of your spine, actually wedges down or compresses. And so this typically happens with a force that's either loaded onto the spine, car accidents, falls, trauma, stuff like that, or it happens with age. It's actually most common, there's in two age groups, right? So the first age group is younger and the teens or 20s, and this is most commonly caused by car wrecks or high energy trauma. And then the second age group is women over the age of 65 or anybody over the age of 65, so it's correlated with age. And so the second most common is older patients. Right, so I think anybody that has one or is questioning whether they have one should be evaluated. So the first step is to diagnose it. And so we start by doing x-rays. So we have the patient stand up and we do x-rays of the area that's bothering them most. And if there's any question based on the x-rays, because some places are harder to look at, as far, the upper thoracic spine is hard to see because you have the shoulders and other things that are in the way. We'll do a CT scan. That's kind of our first line advanced imaging modality. And then if there's a question of whether this happened recently or happened in the past, we get MRIs to help diagnose it. And so the reason we treat them is one, for pain. So the most common complaint of patients with these is that it's painful. And the second most common reason we treat them is to make sure that they don't get worse. If you have a wedging of the vertebral body, patients sometimes get kyphosis and their spine gets malaligned. And so treatment of vertebral compression fractures is most of the time non-operative. And so really a large majority of them, especially in the older patients, go undiagnosed. And so they have an incident where they have some back pain and it gets better over 6 to 8 weeks. And most of the time those don't even get treated or diagnosed. And so the way we treat them if they have persistent pain is either we watch them and just make sure they don't get worse. We could put them in a brace to help stabilize the spine. Sometimes they get what's called a kyphoplasty or cementplasty, where we'll go in and we put cement in the vertebral body that's fractured to help preserve the height of that vertebral body, and that actually helps with pain. Or we could do surgery on them, but surgery is very rare. It's actually under probably 1% that have surgery for a vertebral compression fracture. The best treatment for these is actually prevention, and so we want to make sure that we maintain bone health, right? So the first age group, or the teenagers or the young 20-year-olds that get these, those are high energy mechanisms. You just prevent car wrecks, wear your seatbelt, etc. But the patients that are older that get these, the most important way to prevent them is to make sure your bone health is good. And so all women over 65 should have bone density scans or what's called DEXA scans to screen for bone health and make sure that we maintain bone health, and that'll help prevent them from getting a vertebral compression fracture.